Hello, I am Dr. Linda Parker. There comes a moment in life when you look in the mirror, touch your chest, and quietly ask yourself, how many more years do I want to feel strong, steady, and truly alive? Because after 75, your body doesn't whisper anymore, it speaks loudly, and every choice you make echoes through your heart, your brain, and your future. And one of the most overlooked truths is this. Sometimes it isn't age that slows you down, it's the medications you were told to trust. For years, you believed these pills were helping you, protecting you, carrying you forward. But now, they be silently stealing your balance, your memory, your strength, and your spark. Today I want to speak to you not as a doctor, but as someone who has watched thousands of people regain their clarity, energy, and dignity once they finally understood which medications were holding them back. You desper a life where your hands don't tremble, your steps don't wobble, your mind doesn't fog, and your mornings begin with hope, not fear. So listen closely, because the next few minutes may be the turning point that helps you reclaim the healthiest years still waiting ahead of you. Many medications become more harmful than helpful after age 75 due to slowed metabolism and heightened sensitivity. And this is a truth most people never hear until it is too late. As the body ages, everything changes, not just the color of your hair or the speed of your walk, but the way your organs work, the way your cells process chemicals, and the way even a tiny pill can affect every system inside you. After 75, the kidneys often filter more slowly, the liver clears medications less efficiently, and the brain becomes more sensitive to anything that alters chemicals or rhythm. A dose that was safe at 55 may be overwhelming at 75. A pill that once felt harmless can suddenly cause dizziness, confusion, low blood pressure, or dangerous interactions. And this happens not because the medication is bad, but because the body receiving it has changed. The problem is that most people continue taking the same PRBR prescriptions for decades without reassessment, without adjustments, and without understanding that age transforms how the body responds. The metabolism slows, the tissues become thinner, and the ability to break down drugs weakens. This means the medication stays in the system longer, builds up more powerfully, and causes stronger side effects than before. Even over-the-counter drugs, once taken casually, can have amplified effects that disrupt balance, memory, digestion, and sleep. A simple cold medicine that once gave mild drowsiness may now trigger days of confusion. A pain pill that once said discomfort may now increase fall risk or slow breathing. A sleep aid that once provided rest may now impair cognition or create dangerous dependency. By 75, the margin between therapeutic and toxic becomes incredibly thin, and most people don't realize they are walking on that tightrope why. Another factor is that older adults often take multiple medications at the same time, and the more drugs you combine, the higher the risk of harmful interactions. Even medications that were safe on their own can clash with others, creating a cocktail of fatigue, dizziness, swelling, or memory problems. The human body after 75 simply does not have the same resilience it once had to handle these combinations. Blood flow is slower, organs respond differently, and nerves become more vulnerable. Many older adults believe their tiredness, fogginess, or unsteadiness is just old age, when in reality, it is often the medications silently causing the decline. Doctors see this every day, patients who look frail, confused, or weak, and the answer is always more treatment. Sometimes the solution is reducing or stopping what's already being taken. Many people dramatically regain their strength, clarity, and independence once unnecessary or harmful medications are removed. This is why reviewing medications regularly becomes absolutely essential after 75. Another major reason medications become more dangerous with age is increased sensitivity. As the brain ages, it becomes much more reactive to drugs that affect chemical balance, especially those targeting anxiety, sleep, pain, and mood. Medications that depress the nervous system can act too strongly in older adults, leading to slower reaction times, delayed thinking, impaired judgment, and increased risk of falls. Falls are one of the most life-threatening events for people over 75, and a large portion of them are connected to medications. Even small doses of sedatives, antihistamines, and some blood pressure drugs can suddenly trigger a fall that changes everything: mobility, independence, confidence, and long-term health. THBRE. Emotional toll is just as heavy. Many older adults lose their sense of self, believing they are getting old, when it is actually the medication affecting their brain and body. In addition to this, the distribution of medications in the body changes with age. Older adults often have less muscle mass, more body fat, and changes in total body water. This affects how medications dissolve, spread, and stay within the body. Fat-soluble drugs may linger far longer, building up over time and intensifying their effects. Water-soluble drugs may reach higher concentrations due to lower water levels in the body. This shift in body composition means that the same medication dose can act very differently at 75% compared to 40 or 50. Another concern is that the warning signs of medication harm are easily confused with age-related conditions. For example, confusion caused by a pill might look like early dementia. Dizziness from a medication might be mistaken for high blood pressure. Muscle weakness caused by a statin might be blamed on aging muscles. Digestive problems caused by medications may appear to be food intolerance. When these symptoms are misinterpreted, people often end up on EL medications, each adding more risk, more side effects, and more complications. What most people don't realize is that many medications were never tested extensively in adults over 75. This means the standard recommended doses do not always account for the unique physiology of older adults. The OBR elder body's ability to adapt, compensate, and repair is simply different. Medications that once aligned with the body's rhythm may now disrupt it. This is why deprescribing, removing medications that are no longer necessary, has become one of the most powerful tools in modern geriatric care. Doctors specializing in aging repeatedly see how reducing medication leads to clearer thinking, better mobility, improved sleep, lower fall risk, and a return of emotional stability. The truth is simple but powerful. After 75, medication needs change dramatically, and continuing old prescriptions without reevaluation can silently damage health, independence, and quality of life. The goal is not to remove all medications, but to ensure every pill still serves a purpose, still fits the body's current needs, and still helps rather than harms. When older adults finally understand this, they often feel lighter, clearer, stronger, and more in control. And that sense of control, the ability to stay independent, stable, and mentally sharp, is one of the greatest gifts anyone can experience in their later years. Certain common drugs drastically increase fall risk, memory decline, and overall weakness in older adults, and this is a truth that far too many people only discover after a frightening fall, a sudden episode of confusion, or a slow decline they believed was simply age catching up. But the reality is this: the body after 75 is incredibly sensitive to medications that affect the brain, blood pressure, balance, and muscle strength. Many of the pills people have taken for years, sometimes decades, begin to behave differently in an aging body. They stay in the system longer, act more intensely, and cause side effects that can be life-altering. Falls are one of the most dangerous TS for older adults. They can lead to fractures, long hospital stays, loss of independence, and a dramatic decline in overall health. And yet, one of the biggest hidden contributors to falls is medication. Drugs that cause drowsiness, dizziness, slowed reaction time, or drops in blood pressure can earn a simple step into a life-threatening accident. Sleep medications, certain anxiety drugs, strong pain medications, muscle relaxants, and even some over-the-counter pills can slow the brain's signals just enough to make walking unstable. Many older adults begin holding onto walls or furniture without realizing the medication is the real cause. What starts as minor unsteadiness can escalate into a severe fall, all because the brain and body cannot respond quickly enough. Memory decline is another devastating effect of certain medications, and it often gets mistaken for dementia. Many commonly used for sleep, anxiety, allergies, stomach issues, and even bladder problems, can interfere with how brain cells communicate. For younger people, these effects may be mild or temporary. But for older adults, whose brains are more vulnerable to chemical changes, the same medications can cause significant confusion, forgetfulness, slowed thinking, and difficulty focusing. Families often panic, believing their loved one is losing their mind, when in reality, their brain is overwhelmed by a drug that is no longer appropriate for their age. Once the medication is removed or replaced, many older adults experience a remarkable improvement in clarity, alertness, and cognitive function. But because these drugs are so common, many older adults continue using them daily without realizing the impact. Overall weakness is another silent consequence of medications often prescribed to older adult LTS. Drugs that lower blood pressure too aggressively can leave a person feeling lightheaded, fatigued, and weak. Pain medications can reduce muscle coordination and make simple movements feel exhausting. Some cholesterol medications can cause muscle pain, stiffness, and reduced strength. Even diuretics, which are often used for blood pressure or swelling, can flush out essential minerals like potassium and sodium, leading to muscle cramps, tremors, and fatigue. When the body already has less muscle mass due to aging, anything that further weakens the muscles can quickly turn into a serious problem. Older adults may stop walking as much, avoid going outside, or withdraw from activities they once enjoyed simply because they no longer feel strong. This lack of movement then creates even more muscle loss, increasing the risk of falls and long-term disability. Another issue is that many older adults take multiple medications at the same time, sometimes 5, 10, or even more, leading to interactions that amplify side effects. One drug may cause mild dizziness, another may cause mild fatigue, and a third may drop blood pressure slightly. But when combined, these effects multiply, leaving TBRH person unsteady, slow, weak, and mentally foggy. This combination is extremely dangerous because it turns daily tasks getting out of bed, walking to the bathroom, stepping into the shower, standing up too fast into moments of high risk. Many people do not realize how difficult it becomes for the brain to stay sharp, the heart to pump steadily, and the muscles to hold balance when medications are quietly working against them. In older adults, the nervous system becomes more sensitive to medications that depress brain activity. This includes sedatives, tranquilizers, antihistamines, and Certiber in antidepressants. These drugs can slow thinking and reaction time, impair coordination, and create a sense of heaviness throughout the body. What might seem like simple relaxation in younger years can turn into dangerous lethargy in older age. The body cannot bounce back from these drugs as quick reply, and the effects can last much longer than expected, sometimes 24 hours or more. A person may feel groggy in the morning, dizzy in the afternoon, and confused at night, never fully understanding that the medication is controlling their day. Blood pressure medications can also contribute to falls when they cause sudden drops in pressure upon standing. Older adults may stand up and feel the room spin or experience a moment of blackness. This phenomenon, known as orthostatic hypotension, is one of the leading causes of fainting and falls. Certain antidepressants and heart medications can cause similar effects. While these medications may be helpful, the dose often needs to be adjusted carefully in older adults, and without regular review, the risk of harm increases. Another major problem is that older adults often believe side effects are just part of aging. They think fatigue, weakness, forgetfulness, or dizziness are normal, so they never mention these symptoms to their doctor. As a result, dangerous medication effects continue for months or years, but these symptoms are not normal aging. They are warning signs that the body is overwhelmed by medication. The encouraging truth is THBR is when older adults reduce or stop medications that cause falls, memory problems, and weakness, they often experience dramatic improvement. Balance becomes steadier, walking feels easier, the mind becomes clearer, strength slowly returns, confidence grows, people regain independence, energy, and PBR or pose, simply because the medications that were harming them were removed or replaced. And that is why reviewing medications regularly is not just important, it is life-saving. You must regularly review your medications with a health professional to prevent unnecessary harm and regain optimal physical and mental function, because the truth is that your body at 70, 75, or 80 is not the same body you had at 50. Medications that were once helpful, even essential, can slowly become burdens, quietly causing side effects that chip away at your strength, clarity, balance, and independence. Many older adults continue taking the same pills year after year without ever asking whether they are still needed. But the body changes, your metabolism slows, your organs work differently, and your sensitivity to medications increases dramatically. This means a dose that was perfect a decade ago might now be far too strong, lingering in your system, building up, and affecting the way your brain and body function. Without regular medication reviews, it's easy for harmful patterns to go unnoticed. What starts as a little dizziness becomes daily instability. What begins as a little forgetfulness turns into alarming confusion. What used to be mild fatigue becomes overwhelming weakness. And most people don't even realize that the pills in their own medicine cabinet are responsible. A medication review is not about stopping everything. It is about making sure every pill you swallow still serves a purpose and is not silently causing damage. Doctors trained in caring for older adults understand that medications must be adjusted as the body ages. They know which drugs become risky, which combinations cause dangerous interactions, and which pills can be reduced or stopped entirely. But they can only heed your LP if you speak with them regularly and honestly. Too many older adults minimize their symptoms, blaming themselves rather than questioning the medication. They tell the doctor, "I'm just tired," or "my memory isn't what it used to be," or "I am not steady on my feet anymore." They assume it's age-ber. They assume it's normal. But it is not normal to feel persistently dizzy, weak, confused, or exhausted. These are signs the body is struggling, and often that struggle begins with the medications one takes daily. A review allows the doctor to look at the full picture, how each drug affects your organs, your balance, your sleep, your mood, and your energy levels. They can identify which medications may be interacting with each other, a problem especially common when taking 5 or more prescriptions. Many older adults are unknowingly caught in a cycle where one medication causes a side effect, another medication is prescribed to treat that side effect, and then another drug is added to counter the effects of the second. This cycle leads to something called prescription cascade, a situation where medications multiply and the risks multiply alongside them. A proper medication review breaks this cycle. It helps determine which drugs are truly necessary, which can be reduced, and which can be eliminated safely. Another reason reviews are essential is that older adults often see multiple specialists, one for the heart, one for breathing, one for bones, one for digestion, and each specialist list prescribes medications focused on their own area. No single doctor sees the full list, unless you make a concerted effort to bring it forward. Without oversight, combinations can become unsafe. Blood pressure medications may overlap, causing dangerously low readings. Pain medications may interbar CT with sleep aids, leading to sedation and falls. Allergy medications may impair memory or coordination. Even vitamins and supplements can interact with prescriptions. A medication review centralizes all this information so nothing is overlooked. Regular reviews also help you regain control over your health. When medications are streamlined, people often feel clearer, lighter, steadier, and more energetic. They sleep better, they think more clearly, their mood improves, their digestion stabilizes, their ability to walk and move strengthens. In many cases, reducing medications actually helps people feel younger and more alive because the body no longer battles unnecessary chemical stress. This is one of the greatest benefits of a medication review. It gives people back parts of their life they didn't even realize they were losing. Moreover, medication reviews reduce the risk of hospitalization. Many older adults end up in the emergency room because of medication-related problems: fainting, severe dizziness, confusion, dehydration, low blood pressure, or interactions that cause heart issues. These episodes are often preventable with small dose adjustments or medication substitutions. A health professional can evaluate whether certain drugs should be taken at night, with food, at a lower dose, or changed entirely. They can also ensure you are being monitored correctly through blood tests or check-ins. There is also emotional comfort in knowing that your medications are right for you. Uncertainty creates stress. Many older adults quietly worry, am I taking too many pills, or is this why I feel off? A medication review replaces fear with clarity. It gives you confidence that your treatment plan is appropriate and safe. And this confidence itself improves well-being. Importantly, regular reviews empower you to participate actively in your health. They encourage open conversations with your doctor where you can express concerns, describe side effects, and ask questions. You are not just a patient, you are a partner in making decisions that shape your future. Our voice matters. Your experiences matter. Your changes in energy, sleep, mood, and balance matter. When you share these openly, medications can be adjusted to fit your life, not the other way around. Ultimately, reviewing your medications regularly is not just a medical recommendation, it is a form of self-respect. It is choosing to protect your mind, your mobility, your independence, and your quality of life. It is choosing to stay strong, aware, and stable for the years ahead. It is choosing not to let unnecessary harm steal the vitality you still deserve. Regular medication review is one of EPER's simplest, most powerful acts you can take to live longer, live clearer, and live better. And so, as you move forward, let this be your reminder that your health is not something to leave on autopilot. Your body has worked faithfully for decades, carrying you through joy, pain, growth, loss, and every season of life. It deserves attention, care, and thoughtful guidance, not guesswork, not old prescriptions, and not routines that no longer serve you. When you choose to review your medications regularly, you are choosing clarity over confusion, strength over weakness, stability over fear, and interdependence over limitation. You are telling your future self, I want to stay present, stay capable, and stay alive in every sense of the word. You are giving your heart, your brain, and your body the chance to work in harmony again. And the beautiful truth is this, it's never too late to make Theber's choice. Whether you are 65, 75, or well beyond, every informed decision brings you one step closer to a healthier, more empowered life. So take that step. Speak up. Ask questions. Make the appointment. Review the medications. Reclaim the control that belongs to you. Because your best yay. RS. Don T. Unber D with age. They begin when you decide your health story, I as in T finished.